And welcome to the Dr. Bob Show. Have you ever worried about your eyesight? Do you think maybe I'm getting blind? That there's a haze in front of your eyes that you just can't see as good as you used to. At nighttime, when cars are driving at nighttime, there'll be a halo around the lights that are coming at you. You don't drive as well at nighttime. You can't see as well as nighttime. Something just isn't right and you're worried about it. Could it be cataracts? If you'll see your eye doctor will be able to examine your eyes and tell you if you have cataracts. It's like a piece of cake. But did you know there are different types of cataracts? We'll be learning about what the different kinds are. Do you know that there are different types of lens to be replaced? We'll be learning about all those. My guest is Dr. Darin Smith. Dr. Smith is a board-certified ophthalmologist and eye doctor, and he deals with these problems every single day. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about 4 major different kinds of headaches and how you know which one is which. And if we have time, we'll be talking about symptoms of heart failure. Could you be getting heart failure and not knowing? We'll see if we can find out. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Darin Smith, board-certified ophthalmologist. That's an MD, medical doctor, eye doctor, went to medical school and then does special training in ophthalmology diseases of the eye. And he'll be answering our questions about cataracts. Darin, welcome to the Dr. Bob Show.
Hey, thank you very much, Bob. It's always good to be here.
How does the patient know if they've got cataracts, or what are cataracts?
So, well, first of all a cataract is, it's just the natural lens in the eye that's gotten cloudy. And when the lens gets cloudy, we call it a cataract.
So what are the symptoms? The patient's got to have symptoms if the lens is cloudy.
So, yes, you know what's amazing? There's a big range of symptoms. So cataracts, generally speaking, grow very slowly. And because of that, sometimes the symptoms aren't noticed right away because the brain just kind of learns to ignore it. When they do start to become symptomatic, they might notice some blurry vision, hazy vision. Everything just seems like it's dimmer. Might have trouble driving at night, watching television. There's a whole slew of different things that can
How about
happen.
colors? Are they less bright?
So they are less bright, but you know, Bob, most people don't even recognize that until after they get the cataract out. Again, because it happens so slowly. They don't recognize that they're missing colors. They're missing out on the vibrancy of life and colors and the beauty around them until they get the cataract out, and then a lot of times they're shocked. It's like, this is crazy. What was I missing?
I think that's absolutely great. To me, it brings back the point of the importance of a yearly eye exam. How important that is, because you've only got 2 eyes, need to take care of them, and one of the things you have to take care of cataracts. Does everybody eventually that lives over a certain age going to get cataracts, or almost everybody?
I think you can almost look at this like cataracts are a sign of God's grace on your life, that you've lived long enough to get them. Because I do think if you live long enough, pretty much everybody's going to get them. Now, not everybody ends up with cataract surgery, but for the most part, it's just a natural, normal aging change.
So my wife has had cataracts removed. I've had cataracts removed and lens placed in. She had cataracts early, probably because of sun exposure. Can that do it?
Oh, sure. There's a lot of different theories about things that can make cataracts come on sooner. So again, like a lot of things, there's a range. So generally, cataracts come on with age, but there are people that end up with cataract surgery in their 40s and 50s, and of course, children can get them congenitally. But so family history of cataracts at young age, certainly sunlight exposure, smoking is a big one that really makes cataracts come on more quickly at younger ages.
So stop that smoking, be careful in the sun, wear your sunglasses. Are there different types of cataracts?
There are. So, the term cataract, like I mentioned, is very general. It just means that there's a haziness or cloudiness in the lens. So the different kinds basically are based on and named based on where that cloudiness is occurring. So for example, the most common type of cataract we see is called a nuclear cataract. And that's just where the nucleus, which is the main part of the lens, gets dense and hard. And we see that with age.
The lens just dry up, and the nucleus as you get older, and you can see that when you examine the patient. We'll talk
Absolutely.
about diagnosis. So name me another kind. There's 2 or 3 kinds.
So the main 3 kinds would be a nuclear cataract, and then there's something called the cortex, which surrounds the nucleus. And a lot of times the cortex will get a very white or grayish white type appearance to it. And then
is that common? Or the most common is
it's very common. A lot of times we'll see a cataract that has both nuclear and cortical components. And then what surrounds the entire lens is something called the capsule. And the capsule is what holds your natural lens in place. And sometimes that capsule itself can get hazy.
Whoa,
what's called a posterior subcapsular cataract.
Posterior subcapsular cataracts, and that usually is associated with certain kind of medicine?
Steroids are a very common cause for capsular cataracts.
So if somebody is taking steroids for a long period of time, they can expect to perhaps get posterior subcapsular cataracts, and the eye doctor is important to guide that and saying, whoa, be careful with the cortisone tablets.
Yes, sir, you bet.
How common do you see somebody with a posterior subcapsular cataract?
Every week, pretty much. Now, a lot of times, there's a combination of all those kind of 3 things going on simultaneously. That's the most common thing to see.
So when you tell somebody that they've got cataracts, they say, oh no, that means I've got to have surgery tomorrow?
Not necessarily.
So what do you tell the patient?
So there are some hard and fast rules that I use with my patients. For example, if someone's vision is bad enough that if they went into the Division of Motor Vehicles and tried to get a license, if they would fail their test and not be able to get a license, that person, I'm telling them, look, you need to get your cataracts out because it's a safety issue. If someone's not at that point, it really comes down to how much is bothering them in their life. Are they having significant issues with driving or driving at night, watching television or reading? So a lot of that depends on how it's impacting somebody's life.
Who's at risk?
Mainly as we get older, that's the biggest group.
Smoking.
Age, smoking, diabetics are more likely to end up with cataract surgery at younger ages. Again, folks on steroid use, and not mean like steroid get bulk, but people get on therapeutic steroids for a whole slew of different reasons.
Arthritis, sometimes asthma, a long period of time.
Yes,
so there's
sir.
lots of reasons. That's important, therefore, for everybody to get their yearly eye exam. What age should they start getting yearly eye exams?
Certainly, even children need to get evaluated early on to make sure there's nothing congenital or developmental going on that can be treated at an early age. Now, from a cataract standpoint, once you start getting in your 40s and 50s, an exam every year or 2, I think, is very reasonable. And once you get above 60, really should be every year and maybe even before then.
So if we've got cataracts and we decide that they're going to have surgery, what do you do with surgery? Essentially, you're going to get rid of the old and put in the new?
Yes, sir.
Are there different kind of new?
So there are. So when we do cataract surgery, you're exactly right. All we're doing is removing the natural cloudy lens and replacing it with a clear plastic lens implant.
The plastic lenses, are there different kinds?
There's a whole slew of different kinds.
And that's what we're going to be talking about when we come back. If you have cataracts, what kind of cataract lens implant are you going to have? You'll want to stay tuned. We're talking with Dr. Darin Smith, board-certified ophthalmologist, eye specialist. We've been talking about cataracts, clouding of the normal lens of the eye. There's 3 different kinds. The main kind is a nuclear, then there's some cortical on the side, and then the capsule, there's a posterior subcapsular cataract. Surgery with different types of lens replacement is what we're going to be talking about now. Darin, tell me, first of all, how do you make the diagnosis again?
So the main way we make the diagnosis is when we use what's called a slit lamp examination. So the slit lamp is, you might remember, anytime you go to the eye doctor, they have you put your chin on that little thing, and that little band across your forehead. And when the eye doctor is looking in there, they're using a beam of light that's a slit off to the side, and we can see 3-dimensionally depth into the eye, and we actually see the lens that's gotten cloudy. So we actually get to see the pathology. And then also at that time, we'll look back at the retina and at the front of the cornea to make sure there's other pathology that wouldn't be interfering with the eye or might limit how much vision we might get back when we do cataract surgery.
In medical school, when I got to look at a slit lamp one time, I thought it was the most exciting, most wonderful, most magnificent thing I had ever seen. So you can see the lens, you can tell if it's getting cloudy. So if you and the patient decide on you have to have cataract surgery, how's it done?
Usually cataract surgery is done as an outpatient at like an outpatient surgery center. And mind you, this is one of my very favorite things to do and one of my favorite things to talk about, because the surgery only takes about 10 minutes. And in 10 minutes, you can change your life. You can change someone's life in 10 minutes.
So you don't have to go to the hospital. You don't have to have general anesthesia. You don't have to do all that. It can be done in the office.
So yeah, in an office setting, in a surgery center, we usually do have an IV put in for some light sedation, like if you were going to have a colonoscopy or something like that. So a little light conscious sedation is usually on board. We make a very small incision. When I'm doing the cataract surgery, my incision size is only 2.4 millimeters.
So that's like pinpoint.
It is about the size of a pinpoint. So because of that, there's no stitches required, so there's no sutures, and it's a very fast recovery.
So you make a little 2.5 millimeter incision. So how do you get the cataract out? You reach in there and pull it out? What do you do?
So what we have to do, because of the small incision size, we use something called phacoemulsification. It's
phacoemulsification. What is that?
So basically, it's ultrasound that breaks that cataract up into small little bits, and then we suck it out in small little bits.
So you remove it that way out of a little, and now you got to put something back in there.
Yes. So one of the great things that the lens implants we have now are foldable plastic. So they are plastic, usually an acrylic, either acrylic or silicone. And you can fold them up in a little cartridge and then slip them through that tiny little incision and unfold it inside the eye.
And so it goes whoop, and it's out there inside the eye. And is that better than the old lens, or perfect? What is it?
They're much better. Well, because anytime you can make a smaller incision, it's going to be an easier recovery and an easier experience for the patient.
Are there different kind of lenses that you put in?
So there are. So generally speaking, the size of the lens is basically about the same amongst all the different models and brands. Now, no matter what, all the lens implants that come in different powers. So it's the power that's very important. And before you ever go to cataract surgery, your eye surgeon will have done some measurements to know what lens power to put inside the eye.
So you have different powers of eye and refraction in that lens that you're going to put in somebody else's eye?
Yes, and so not only do we get rid of the cataract, we can actually get rid of the need for glasses sometimes, which is amazing.
So when you put in the new lens, what are the different kinds you can use? Because I know there are 3 or 4, 2 or 3.
There are. So there's 3 general classifications. There's what's called a standard lens, which is what's normally put inside the eye. So the standard lens is also normally what's covered by the insurance. So there's an economic issue. So a standard lens will help primarily for distance vision and doesn't really do anything for up close. So it's mainly a distance vision, and it doesn't do anything for something called astigmatism. So some people that wear glasses or contacts, they might have heard the word astigmatism before, and they associate that with bad. Astigmatism is bad. It just causes blurriness. And what astigmatism is, it's just where the cornea, which is the front surface of the eye, instead of being spherical like a basketball is a sphere, it's more oblong like the side of a football. And so the second type of lens implant is something called a toric lens implant, T-O-R-I-C, toric lens implant that can help reduce or eliminate astigmatism. So for people with a lot of astigmatism, a toric lens implant can be a really nice advantage. It can really fix something that's been there maybe for lifelong.
So now we're talking about not only do you have a clear lens, but you have one that's established for it so it can focus up on reading. Is that what correcting the astigmatism would do in a cataract replacement, lens replacement?
You're close. So a toric lens implant will still only give distance vision. So even with a toric lens, people will still need glasses for up close, unless the third type of lens implant is something called a multifocal lens implant.
So there's one with different. Tell me about that one.
Yeah. So the multifocal lenses can give you a range of vision, can give you the distance vision and up close, and depending on the model, sometimes the intermediate computer vision type of things. And all of those kind of lenses can also correct the astigmatism.
Is there a kind where the eye muscles adjust, fixing the lens to a different fatness or pulling it out? Tell me about those.
Yeah, so what you're describing, there's something called a crystal lens. And I have put some crystal lens implants in there. And the way those are marketed is to adjust kind of like your natural lens. Generally speaking, I don't find that they work strong enough to really help people as much with the up close. So that is another type, and there are certainly some surgeons that use those. My preference, if someone's going to try to get that up close vision like they really want, usually a multifocal lens is a little bit better option in my opinion for that.
So basically you like to use the one that lets you see bright-eyed and it's nice and clear, but you have to wear reading glasses, or the multifocal. So tell me again how the multifocal works.
So the multifocal lens, like a lot of things, has advantages and disadvantages. Okay, so the multifocal lens has these tiny little circular rings on the lens implant itself. And what those rings do is they break the light that's coming in through the eye. It breaks that light up into two focal points, one for up close and for one for looking off in the distance.
How do you know, how does the eye and the brain know which one is looking? Just automatically does that?
The brain just adapts. It's amazing what our brains can do, and it just adapts. The downside for some folks with those rings is sometimes those lens implants will cause more halos for nighttime driving.
So in some people, you'll have nighttime problems of doing that.
That's certainly a possibility.
Tell me some stories about what people say, because this, I think, is the most exciting part of this, the fact that you can change people's lives. What do they tell you after the cataract surgery is done?
So I certainly have a lot of stories, and I didn't know you were going to ask me this question, but the first person that comes to my mind, I was a lady about a year ago. I did her surgery many, many years ago, and she sought me out in clinic, and I remembered who she was. And I remember when I did her surgery, she was so excited that she could see leaves on the trees instead of just being a green blob, and that sort of thing. She was a very energetic, happy person, and she was dying from cancer. And it was in her last, little bit of life. And she sought me out to just once again tell me how much cataract surgery changed her life and changed her outlook, literally, on life. And that story is amazing. And like I said, a 10-minute procedure did that for that lady. So it's amazing.
And what I see in my practice is people that have had cataract surgery by you have said, it changed my life. I didn't realize I could see so well. Darin Smith, thank you so much for coming to the Dr. Bob Show. You're a great, great teacher, and I appreciate your enthusiasm and your teaching the viewing audience.
Thank you very much. Thank you for having me.
Hope you'll come back again. I'd like to talk about diabetic retina problems. Will you come back?
Absolutely. Just ask.
What a wonderful teacher. If you've got cataracts, you'll know it. You'll know that there's different kind of lens and it can be fixed. Now, a lot of information for you. We'll be talking about 4 major types of headaches. And could you have congestive heart failure and have the symptoms and not even know it? I saw somebody today in my office that had that. A lot of information for you. You'll want to stay tuned. I want to thank Dr. Darin Smith. Wonderful discussion on cataracts and what we can do for them to see better. Now, a question for you, the viewer, that I think will be important to your health. Dr. Bob, I've got headaches. What can I do for them? Well, that's a great question, but there are different types of headaches. So let's look over the 4 most common types of headaches, or go to 5. Number 1 would be a tension headache. A tension headache is a band-like headache. It stays steady, but it goes away quickly. Sometimes we don't even notice that it's there till we think about it. It's associated sometimes with tension, with pressure. And those are tension headaches, band-like headaches. You give Tylenol for that, and the Tylenol will help. Migraine headache. Migraine headaches are vascular headaches, so they pound. They go bang, 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 bang. Frequently they're one side, but they don't have to be. But it is a vascular headache. If untreated, it lasts 72 hours. The treatment is extremely good. There are medicines to prevent beta blockers, calcium channel blockers, or there are now medicines to treat the headache once it starts. In the old days, we didn't have anything to treat. Once the headache started, you were in trouble. But now there are lots of good medicines, sumatriptan agonist medicines like Zomig and Imitrex, and there are other medicines to treat the headache. We're now even using some Botox to take away some of the pain that triggers people to have migraine headaches, if you can believe that. So migraine headaches can be treated well. The third time, sinus headaches. So sinus headaches are usually one side. You usually know if you've got a cold. You've got symptoms of a common cold and you're left with discolored nasal exudate, pain on one side. Frequently it's where the cheeks are, but you know it's a cold and you've had a cold before, but it just doesn't go away. The treatment would be decongestant, saline irrigation, and if your sinus infection doesn't go away in a period of 10 to 14 days, talk to your doctor about it. There's good medications, better decongestants, better intranasal steroid sprays that he'll prescribe, and maybe an antibiotic, maybe getting a CT scan of the sinus. And then there's the headache of a stroke. That can be what we call a banger, a headache that you've never had before. Something's going wrong. You know it's going wrong, and that's a sign that you may be having a bleed into the brain. When that happens, you must go to the doctor immediately. Get somebody to take you if it's that one. So know there are common types of headaches, and know there's good treatment for those. And now, next question, Dr. Bob. What are the symptoms of heart failure? Well, heart failure is where the heart is just not beating well. There's several reasons why that is. But when the heart doesn't beat well, the lungs fill up with fluid. And when the lungs fill up with fluid, they can cause shortness of breath. We call it dyspnea on exertion. So people just walk a little bit. They start taking deep breaths. They have to sleep on 2 to 3 pillows, because if they lie flat, the lungs get more congested and they get short of breath, and they wake up in the middle of the night with shortness of breath. And so their feet swell, pedal edema, and they can't get their shoes on. If you push hard on the head of the leg, it will leave an indentation there. That's called pitting edema. When you have pitting edema, there may be 5 or 6 pounds of water. The lungs will be filled with fluid, and you'll have shortness of breath. The heart's not beating well. See your doctor. Tell him, do I have heart failure? And he'll be able to do the right test, listen to your heart, get the proper x-rays, and he'll be able to guide you toward good health. Diuretics sometimes is all we need, but sometimes you have to go further into the causes. Congestive heart failure is dangerous, and you want to be sure that you and your doctor work out the proper program for that. That's all the time that we have for this show. Remember, those 4 things we like to talk about. Number 1 is exercise. Be sure you're exercising at least 5 days a week, 30 minutes, continual exercise. Grab those tennis shoes, walk, jog, swim, do anything you want to do, but make sure your exercise is regular. Get 7.5 hours sleep. You'll feel so much better if you sleep properly. So if you're not getting 7.5 hours sleep, talk to your doctor about it. Is it because you've got pain that's keeping you awake? Is it medicines you take before you go to bed? Are you not calming down before you go to sleep? There are lots of ways to mellow your life, getting ready for a good 7.5 hours sleep. You'll perform better the next day, and so will the people around you. And we need to be sure that we're eating properly. We all know how to eat. It's a good breakfast, fruit and fiber. Eat properly, eat less, but be sure that you don't diet. Just change your eating habits, fruits and fiber and vegetables. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Have fun laughing. Laugh a lot, giggle a lot. You'll stay healthy, and people will stay healthy around you.